Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Reform Advocacy, where we address problems in the healthcare system and try to take actions to make them better for all of us. Today is more of a learning day. Before I get started, I want to point out that in the description area below, you'll find a link to Healthcare Advocacy, which is a newsletter we write, and what's in there in that link today is the script for this video. All the links to all the stories that I'm going to talk about will be in there. Okay, let's get started. Number one, researchers develop a potential universal CAR T-cell therapy for blood cancer. In The Lord of the Rings, there was one ring to rule them all. Now a team of researchers is developing their own single ruler, an approach to CAR T-cell therapy that could treat all forms and types of blood cancer. In experiments in mouse models of different blood cancers, the treatment rapidly eliminated tumors, including in mice with acute myeloid leukemia, a difficult to treat type of blood cancer for which researchers have struggled to develop effective immunotherapies. There was also no evidence of serious side effects in the animals, and finally, and distinctly from the standard approach to current CAR T-cell therapies, it actually provided the mice with a healthy supply of new blood cells. There will be a link to this story again in the newsletter. Here's another one: repurposing common medications to prevent cancer. A group of researchers are studying treatments that are widely used for other diseases for possible roles in cancer prevention. A post in the Division of Cancer Prevention's Cancer Prevention Science blog highlights two recent studies exploring the use of statins, typically used to lower cholesterol, to prevent ovarian cancer, and the use of the diabetes drug metformin to prevent breast cancer. Watch this space for further developments. Lung cancer trial of osimertinib. In the nearly 700 patient study, people who were randomly assigned to receive osimertinib after surgery to remove their lung cancer tumors, known as adjuvant therapy, lived substantially longer overall than people assigned to receive a placebo after surgery. At 5 years after starting adjuvant therapy, 88% of the people treated with osimertinib were still alive, compared with 78% of those treated with a placebo. Typically, osimertinib is given after surgery only if the cancer recurs. This study provided the medication just after surgery to everybody. Of those in the placebo group whose cancer recurred, 40% were provided osimertinib. That's because you know that's the good treatment. Now that somewhat confounds the 78% survival result as a placebo group, but it has no effect on the 88% 5-year survival rate, which is really impressive. There'll be a link to the full report in the newsletter. Okay, let's go back to Medicare Advantage shenanigans. We have spent a long time talking about these in our newsletter. I want to first give you a disclaimer. Let's remember that Medicare Advantage is private insurance chosen by a subscriber to replace Medicare. Medicare is provided by the U.S. government. Medicare Advantage comes from private insurance companies. These private insurers are paid $1,000 a month by the federal government to pay bills for their subscribers. That's in addition to what the subscriber pays to Medicare for Part B and any monthly payment they may have to the Medicare Advantage company. Okay, now that Medicare Advantage insurance company, they will get paid more than $1,000 a month if the patient has certain risk factors. Most of the top 10 companies providing such insurance have been accused of criminal fraud for reporting their subscribers were sicker than they really were so that they could get the higher payment from the government. What a charming bunch. Okay, let's remember, for those of you that took economics, there are only a few ways to make a lot of money. You can increase the volume of sales. add more subscribers. This autumn, you're going to see lots of misleading TV ads having to do with Medicare Advantage. You can increase your income by getting more payments from the federal government by claiming people are sicker than they are or upcoding. Or you can just deny claims and not have to pay money out. Let's look at the claims denial. We've written about this a while ago. I don't know if you remember it, but let me share it with you. Cigna insurance company was caught, they still use it, and there's a lot of investigation about it. They use a software tool to automatically deny claims. Their record so far is 300,000 claims denied in 2 months. Wow, it's about a second apiece. United Healthcare, the nation's largest insurer, uses predictive software when evaluating claims. The name of it is NaviHealth. It's a care management company that they own. One of their sub-companies, Optum, bought it. That company uses a tool called NH Predict, and it sifts through millions of medical records to match patients with similar diagnosis and characteristics, including age and pre-existing conditions and other factors. And based on these comparisons, an algorithm anticipates what kind of care the patient will need and for how long. Sadly, if you only rely on the software and not the actual condition of the patient involved, you wind up denying coverage to those who need it. Patients, providers, and patient advocates in several states said they noticed a suspicious coincidence. The tool often predicts a patient's date of discharge, which coincides with the date that their insurer cuts off coverage, even if the patient needs further treatment that government-run Medicare would provide. I'm shocked to think that they would cheat like this. Not really. As a result, a new set of federal rules for Medicare Advantage plans are beginning in January, and they're going to rein in the use of algorithms in coverage decisions. Insurance companies using such tools will be expected to ensure that they're making medical necessity determinations based on the circumstances of the specific individual, not the overall average that the algorithm provides. Okay, well, all I have to say about that is we'll see, and we'll keep an eye on it for you. That's what we have for today. Like, share, subscribe. The description will be in the comments section below. Have a good evening.